Hey guys, we are live in the tea room with Talia Reese. We have Oshri Silverbrand here with us. Hey, I said your last name today. I never do that.
Yep, this must be a special day.
What's up, Oshri? Wait, you just got back from Florida, right?
I did, and I look exactly the same. No tan, you know.
Tan?
I made
Why
sure
not?
I stayed under my wide brim hats.
Oy, so boring. Anything exciting though in Florida?
So we tried out a bunch of nice restaurants.
Where's this, Miami?
So we did half in Aventura, and then we went to Miami after.
Okay, give me a highlight.
So there's this really cool place in Aventura. It's called Barrel Wine and Cheese. I've never seen anything like it. It's a kosher wine and cheese bar.
Oh.
And they have...
Where was
What
this?
type of cheese? They never have good kosher cheese.
Just they had like cheese tasting boards, and like you get like a burrata salad, and you know, I feel like it's hard to find burrata
Kosher
in the
burrata.
United
Does it
States.
explode in your mouth though?
Yes, I'm obsessed with burrata.
Oh, okay.
So basically, they have these wines on tap, and you get a card like it's like you're in Dave and Buster's, but for adults, and you put the card in whatever wine you want to try, and then you can either try or get a full glass, and you just go around and you take your glass and you try anything you want, and then you know it racks up, and then you pay at the end.
Oh, that's
It was a
fun.
really cool concept.
All kosher wines.
All kosher wine. I think it would do really well.
Was it
locally?
So was it mavushal or not mavushal?
It was a mix.
What? Does anybody here know what that means, by the way?
Listeners will know what that a mavushal wine bar. That's when you're getting really specific.
Yeah.
That's like Borough. Does Borough Park even have? If they had a wine bar, there'd be like a kosher le Pesach, mavushal. Like that's what's funny about being Jewish. It's like the more specifically Jewish you can get,
Yeah.
the more.
But even like I live in the most progressive, like we're almost not modern Orthodox. We're like falling off the cliff towards conservatism. And the one thing our rabbi like super cares about is this mavushal thing, which is very, very shocking.
Let's very, very shocking.
have
You
to,
almost
no,
said.
I have to explain like how weird it is that in my town where everything is acceptable, this is like the hard line in the sand.
That's the boundary.
Yeah. So mavushal is like, is the wine pre-cooked?
It's been boiled. Like you boiled out all the goyish fingerprints.
Yeah, so that it
blood.
could then,
And all the
so
flavors sometimes.
Exactly. So that it could then be served by anyone, not just a Jewish person and who, you know, who's serving you. So that's very restrictive in terms of who's pouring your wine. But
So this one, you're pouring it yourself. But in the on tap, everything's mavushal, but they had a non-mavushal section, so they had to give you a special glass. Like,
Oh, this is for real. Oh my God. I thought we were joking
And then
here.
at one point, I didn't realize
It really
And
was
I went
that.
to pour the not the mavushal wine into the non-mavushal cup, and I swear the woman came from like 50 yards away. She's like, "No,
Very serious about
stop."
this.
But I didn't
no,
realize.
but listen. So Friday night, we
Pulling
did
up
this.
your bio. Go on.
Okay, so Friday night for my daughter's bat mitzvah at our synagogue, you know, with just a group of friends and family. So this wasn't like a synagogue event.
Yeah.
We wanted the more expensive wine and the more like the good wine because it wasn't for the masses. It was just for our close friends.
Right.
And that's typically not mavushal.
Right.
And kosher non-mavushal, that's
we
the
had,
holy grail.
Right. So we had non-mavushal wine because it was just our friends and family. And we got like caught like it was, you know, cocaine bust because
Caught
they
by
were
who?
like, oh my God, it's non-mavushal. Like we had to clear it from the tables.
Get out.
No, I'm not.
Because this was in a shul?
Yeah, because it was in a shul. But
you're bringing
meaning-
in pork or something.
Ear, nose, and throat. Is that like head, shoulders, knees, and toes?
No, it is seriously connected, not in the direct way that you mentioned, but you know,
Okay.
yes, it's
Okay.
one unified airway.
Because when I was in Miami, we did wakeboarding, and I kept face planting into the water, and I got all this water in my ear, and my husband was like, blow out your nose. I was like blowing out my nose like a crazy person. He told me the water would come out.
Well, it's true. There's a pipe, you know, called the eustachian tube that goes between the back of your nose and the inside of your ear. And if you shoot up the pipe, but it goes like this way, then you can clog up your ear. And if you want to get stuff out, you can blow it out.
I'm going
So
to
it is
have to
connected.
listen back on
I know,
that 10 times.
I know.
I didn't even say
Just
the
saying,
best part.
just
here.
saying.
No, it didn't work.
Tali, I'm about to say something really like a little sexist, but I think I said Tali is the only lady surgeon that I know, that I've ever known. I think
Really?
she's a lady surgeon.
Really? In Great Neck? There's no other lady
who's a
surgeon?
No,
Excuse
surgeon's
me.
like a whole other
Who is
level.
a surgeon, Osh? Seriously.
Oh, they're doctors, but not
Doctors.
surgeons.
Yeah, please. She's
Not
a
the
lady
same thing.
surgeon. Also a professor at Touro College of Medicine. Okay, so you specialize in airway surgeon.
I do.
Sleep apnea. Ugh.
I mean, for kids.
Do you see
Wait, can I
everyone's
ask you,
husband?
do you deal with the
No,
people?
no. I only do
Oh, so only
pediatrics.
pediatric,
I only
okay.
do
Wait,
pediatric
so you don't
ENT.
deal with the people with in the commercials who have the holes in their
I do deal with tracheostomies. I do deal with that. I do.
Don't smoke.
Yes. That's adult. That's adults. I don't do laryngectomies, which is what you're talking about, but I do a lot of
I got you on
airway stuff. Yes.
But that
So,
commercial
okay.
freaked me out. I never like picked up a cigarette in
You
my
never
life. after
smoked
that.
again.
that.
You never
In my
smoked
life,
again.
Not again, not
I just
once.
said that.
I saw that commercial when I was like 7. I'm like, I've never, these ones,
Yeah.
I'll never stop. Like you'll get emphysema.
Right.
Like I was like, yeah.
It's not worth it.
Those
Not
ads
worth it.
worked on
They need to
me.
bring
I know.
them back.
I know. They worked. And like the pictures of the lungs, remember they'd show those blackened
Black.
lungs?
They're like if you have one cigarette, no, we didn't know as kids.
It's
they're showing
really scary.
stage 4,
Right, lung
like,
cancer.
crackhead, homeless lung
But can you get
cancer.
that from vaping? That like weird whole thing.
So nobody
Everyone's
everyone's
talking about
pretending
vaping.
like vaping's like all okay. You're pouring chemicals into your lungs. I think it's not okay.
No, apparently
it's worse
people
or
are
the same?
dying from
I don't know
one
if
vape.
it's worse necessarily, but it's definitely not good.
You know why I think it might be worse? Because I feel like with cigarettes, people used to go and take a break. It wasn't all the time. With the vaping, they're doing
They're
it
just
all
walking around with
the
those
time.
pens all day
They're not
long.
stopping.
I
Okay,
know.
I'm not done with the bio.
Okay, keep
piece.
going.
sorry.
It's very
Okay.
impressive. Yeah.
It is very impressive. Okay, so we established Tali only operates on babies. On
Unless
children.
I'm on call on the weekends, and then I do everybody.
Wow,
But
so she's a baby
typically.
surgeon, not like a baby surgeon, like a baby
Yes.
surgeon,
A lady surgeon for babies.
a, la-
I'm not like
Lady-
Doogie Howser of
a lady,
surgery.
right? Exactly.
Yeah.
a lady. She's a grown woman
I am.
who's a baby lady surgeon.
I like
That's
it. Yes.
Very, very unique. Specializing in complex head and neck conditions in children, Columbia University, because that's who I would trust with my baby with like a cigarette lodged in its lung.
Why is it always with the babies and the cigarettes with you?
So, well, first of all, you're in your scrubs.
Yes.
Where are you? Where did you come from today? Like, why?
Okay, I did come from my house, but
Okay.
I'm not on call currently. Obviously, I would have to be closer to the hospital. There's
Okay.
kind of a rule about that. You got to get there in an emergency, and I'm a little far away, but I am always like backup. So there's like the way that we cover our hospital is that it might be that an adult ENT, like currently this weekend, an adult head and neck ENT is on call. But if she has an issue with a young child or a baby, she might call me. So I'm like backup.
So you're always wearing scrubs ready to go.
No, I mean, not always. Sometimes I'm wearing jeans and a t-shirt. I don't have to be like
Oh, I see.
Superwoman.
It says peds,
Yes.
oto,
Peds, oto.
laryngology.
But I
Right.
just printed this like on the form when I bought my
But you're
figs.
ready to go because you're
I am.
on call.
I am.
So
I mean, on backup call. Let's not overstate it. Because
Okay.
if I'm on call, I would not be here.
She'd
in
have
Long
her
Island.
phone in the
40
room.
I'd be
minutes
in
away.
Westchester. Yeah.
So, I mean, like, what did anything happen this week?
Yes.
Oh,
actually.
what
Well,
happened?
like, so, okay, this is kind of crazy, but it's like very typical. I feel like every single time I try to do something self-maintenance wise, and I'm really thinking about it like, okay, I'm not on call. I'm not in the OR. I'm like in the office. So like, what are the chances that like a true emergency is going to happen that's going to interfere with whatever personal thing I'm trying to accomplish, like a GYN exam or something of that nature.
Sure.
But I do keep my phone with me. So anyway, this Friday, my main like goal was to see all my patients and then make it to the Medi Spa that was staying open for me. Like this esthetician
You're a
was
VIP.
hospital calls me.
of course.
4-week-old baby, respiratory distress, get like 2 videos from my resident. One is this baby like seriously working very hard to breathe, looking like they're gonna like serious, but like that they're gonna tire out.
What happened? What happened?
So
to
the baby has something very, very common to see in pediatric ENT, which is something called laryngomalacia. It's a floppy airway. So it's a normal baby, but their airway's like flopping. And so they are
Oh, okay. So
working-
it's not like the baby
born this way?
swallowed something.
No, this was not an airway foreign body like
Oh, no.
out of nowhere, but it was like the baby was dwindling. So meaning was like kind of on the edge, and then
old?
was 4 weeks.
So born with a floppy airway.
Born
is
with
that,
a floppy
is that
airway.
Like is that a preemie? Could that just be a normal
That's
baby?
a very good question, actually. That's a very smart question. Actually, statistically, no. You would think it's more preemie because like everything's immature.
Not formed.
Right. But it's like actually just common. And it's just, again, if it escalates to the point where the airway is like really flopping to the point of blockage,
Yeah.
you have to do something about
Do
it.
they know at birth?
he was squeaky at birth, like making some noises, but he was like doing worse and worse with time.
It's a boy.
And it kind of peaks.
I bet it's usually a boy.
No, it's not always a boy, but the thing is it kind of peaks at like 4 to 6 weeks. So they might seem kind of okay and then they get a bit worse. So point is.
So you went in.
So point is I'm being called.
And you look like a monster.
Yeah.
No, I look.
Freddy Krueger's here.
No, I'm like.
ready to operate.
Well, the point is I was like, I am going to look insane, but like there's just no choice. So I just. And it's just crazy because every ridiculous scenario is always like, it's like someone's tracking your car. Like I'm just pulling into the driveway and I'm about to like get out my car and then like, boom, something really emergent happens.
Dafka.
Yeah, exactly.
Yeah.
But it just feels like someone's watching you. Like it's very, like, those shows where there's like cameras watching people's
like the
movements.
universe says, Tali, you can't have a life.
Exactly.
We need you.
Exactly. And so, but it's like, I have to go. This is like it's not like, there's not like a
like, there's not a lot of people that can even do what you do.
There was another, like one of my colleagues was there, but it just situationally, she had been operating for a very long time. It was like needing a second pair of hands.
It's like a pilot when like they need to rest.
Yes,
and you're like, go rest. We'll take the delay.
Yeah, exactly.
So,
like 13 hours on.
So what did you have to do? How do you open that baby's air?
First of all, I was slathered in like moisturizers, steroid cream. I had like a layer of white.
Oh, you?
Oh my God.
No,
okay,
me.
I thought you were talking about the baby.
No, not the baby. We're focusing on me and my embarrassing moment.
The baby.
Forget, I care about the baby, but I'm like very scary looking. So I'm like, I don't
think the baby will notice.
The baby didn't notice, but the parents do. I mean, the parents are like, who is this freak of nature?
Who's this vain motherfucker?
Like,
I want some nerd, some fat little Jewish nerd.
I know, not this woman who had her neck lasered like 5 seconds ago.
That's actually a very interesting point.
Well, I had had choices. It's like, I could own it, but like, how do you cover up you can't wear like a turtleneck to the OR in the middle of the summer. Not in the summer. So
it's very air conditioned,
I had this hoodie, so I zipped it like all the way up to my chin.
So did you explain what was going on?
So I walk into my OR because I have like a rule that I have to see the equipment set up. Like I won't let the baby come in until I know everything's there because it is safer before you start anesthesia it's not that particular situation is better to be really set up than to bring the baby and start anesthesia without being set up. So I had
to go in
sometimes. So I go in and I just like walk in. There's like anesthesiologists, nurses, another like 2 head and neck surgeons. And I'm like, listen, guys, I just had my neck lasered. I just want you to know, I'm just putting it out there. This is why I look like this. We got to be honest. And then we're going to like get over it. And I just owned it.
Yeah.
But like with parents, I didn't really want to tell them that. So I did the hoodie and I just was like, can you sign consent for this?
Yeah.
Forget about my neck.
So how did it go? What did
amazingly,
what did you do to the baby? Like,
what did I do to the baby?
How does that work?
So, okay. What you do is all endoscopic. So it's like internal work and you basically, not in this particular case, you don't cut from the outside. So in this particular case, you basically work on the inside with special cameras and special instruments that cut this like tight airway and then shave the floppy bits. There's all these like shaving instruments. And then I have this like laser / it's called a coblator, but it's like similar that tightens. It's kind of like my neck, actually.
Right. It's like an
to be honest,
tightening.
It was really similar to my neck, except for that on a baby airway.
Well, that being tight, my God.
I know. And like undoing the floppiness, and basically did this endoscopic procedure that, thank God, baby tolerated really well, and then brought him up to the pediatric ICU, and then whatever.
So
then
the baby shouldn't need anything in the future?
I hope not. It's always possibilities for needing more. But I went back Saturday morning. I wasn't on call, but just because it was the baby that I operated on.
Yeah, sure.
And then I waited until they got the tube out. So you extubate the baby, but I didn't want to leave the hospital. I wanted to see that he was doing well and staying well. Right. And I hung around and then I went home.
So what happened? Like, so are the parents, are they just like so grateful to you? Like how are they with you after
sometimes, yes, sometimes they're like crying.
You're like God in the
leaning in for a hug and like crying and
Yeah,
like, you know,
okay.
really, really, really grateful. Sometimes they're just,
and
you
you're
know,
like, I'm showing a gear.
it's very funny because, you know, I'm never like sure when you should like initiate physical interaction.
Initiate. A doctor would do that?
Well, like sometimes these are very like these are moments where like you are at the edge and you're at the edge with their kid, and I'm a mom and I've got babies, and you see it in their eyes and they're like all nervous, like they want to like hug you, and if you let them do it, it's like a stress relief.
Cathartic.
Yeah, it's really
Wow.
cathartic.
So
I think it's probably better from a woman. Like I wouldn't want a man.
Well, it just depends. Like it depends if
why-
it's the
now
man,
you're
the
being
man.
sexist.
Yeah,
Well,
exactly.
Who cares?
I don't know. Like I just feel like if a woman's hugging you, it's less like
Well,
likely
you're
to be
not
creepy.
like making out, you know, you're just like, oh my God, you know,
Have
your
you ever
baby's
had-
alive.
Too much sometimes, I swear.
No, have you ever had a male doctor hug you other than your friend's husband who did your colonoscopy for
I
you?
mean, I've had
Wait,
male
why
doctors
did
go
he-
up my snatch. So,
But are they hugging
And
you
why
after?
did he hug you after your colonoscopy? That I have to hear about, because that's weird.
if I told them,
No,
my
I'm just teasing
Well,
her
we'll get
because
to
she
that.
went to her
Yeah.
friend's husband for the colonoscopy.
I know.
Yeah. Oh, I told you that.
I just
Yeah.
don't know about that.
Wait. So okay. So
But this is like, but you know, the thing is that this is like what I live for is like, can you do it all?
well, you are a self-described adrenaline junkie, which
I
I
am.
think is so interesting. Well, that's why I'm like, I want to hear more. What about a baby? Do you have any stories? Or story? I mean, you know, actual.
Well, there's
incidents.
stories, but they also
there's
have-
stories.
yeah.
But about where a baby. What are some of these foreign objects? I want to hear about the irresponsible
Yeah, like the batteries,
parents.
like those little batteries. Those are scary,
yeah.
right?
Oh yeah.
What was like the craziest, most irresponsible parent thing that let something happen to a baby or a toddler, an infant?
Okay. Well, like the irresponsible. So a lot of the times it's not intentional.
Well, actually, I shouldn't say that. Anything can happen.
no,
My
but
daughter ate a whole jar of vitamins as a 3-year-old, and now here I am judging.
Wait, did she like throw it up?
Yeah, she threw
right.
up.
No, but
No,
sometimes
I think she just
How did you
pooped
know?
it out. We saw the empty.
Were they like gummy
Yeah.
vitamins?
I don't remember. I think chewables, but she just ate a whole thing of them.
What vitamin?
We were in Winnipeg.
What vitamin?
Multivitamin.
Oh.
She just ate a whole at 2 or 3
right,
years
like
old.
she just
I guess you
got
just
into
pee it out, right?
Well, I'm just saying.
That's the worst thing I felt that I
Yes,
did.
it's
But
pretty bad.
You know what? I want to be judgy right now, and I'm not usually judgy, but I want to hear
I mean, most of the time, okay, the majority of the time,
Yeah.
it's like they find something on the ground. So they're crawling around and you could,
so it's not an infant,
Like a Lego. or
no, I
something.
mean, a Lego
Infants
or
are
it could be,
crawls,
right.
that's
I'm just
clear.
saying, but that being said, a lot of times it's really somebody fed them something they should not have due to their age. Meaning, I once had to
that
get
makes sense.
a Skittle out of an airway. And the parent's
Skittle?
explanation as to why this, 18-month-old was
Oh.
eating Skittles
They had
was
2 teeth.
no, right, exactly. Was well, that's what their siblings were eating.
Oh no!
And they didn't want them to be jealous.
You were to get a Skittle
Yeah,
out.
but like that's really a problem.
But you know
Or
what's
the
scary? Popcorn,
okay,
right?
I want to hear about that.
popcorn, nuts. Yeah. And so like there's definitely a lot of nut situation where we just recently, for example, had a family and they think they're being like wholesome and they give them, some trail mix instead
Right.
of like candy. Like I would give my kids,
No.
not hard candy, but like, Twizzlers and stuff like that. But then the trail mix had some nuts in it and the baby aspirated the nut in the trail mix.
But isn't
But
it
why-
It's not too late to do surgery. Don't you have to do like the Heimlich maneuver or something?
Yeah, but the Heimlich doesn't get it out of the airway necessarily if it's like all the way down in the lung.
Oh.
Like it would if it's high,
Yeah.
but it's past that point.
God.
Hyper-
So then how do they know there's a problem? They're having trouble
Hyperventilating,
breathing?
right?
Yeah, they're either like, the worst one. So
Did you have to operate on a Skittle? That's like the Seinfeld episode.
yes, when he
Okay.
drops, the Mentos, what did he drop
Yeah,
in that? He was watching the surgery
Yes.
back in the old
Oh,
days.
yeah, I remember
Back
that
in the old
episode.
days, right.
It was one of those yeah.
I can't remember what the candy was, but in the
Gosh,
old
I
days,
know,
you
it's gonna
could
come
watch
to me.
surgery like from
the
a
caramel covered
audience.
chocolate thing.
Rolo? No, it wasn't
Like
a
that,
Rolo.
but it was like that.
I thought it was
Yeah.
like a 2-word thing.
We're getting close. So,
Right.
so,
An old boy
so you
or
had to
something?
operate on a Skittle.
No, so some like the scariest ones that I've been in
Yeah.
was one time it was a cashew, but I mean like
What's
the
with the
whole
nuts?
airway because that's a big one. It's
they
Yeah, it's also
allergic?
curved.
But are they
No,
allergic?
it wasn't an anaphylactic thing. It was actually what you just said. What my partner, one of my like wise partners,
Babe,
she's
what are
always
those
like
called? Babe.
Babe Ruth. I don't know.
Yeah, I told you
no.
it was 2 words. Babe Ruth.
Yeah, not Babe Ruth. Something Babe. All right,
But
whatever.
anyway,
yeah.
point is that that until you have molars that can chomp
Right.
the nuts, it's very easy to like aspirate them because you haven't ground them
Yeah, they
down.
can't
What does aspirate?
It like
mean?
goes down the wrong pipe. It goes down into
But
the
is
lung.
there a wrong pipe? Like, what is this expression? Go. There's one pipe.
No,
there's
there
the
isn't.
esophagus.
Wait, but if it
No,
goes down
the
the right pipe,
esophagus
can it
is
get
for
stuck?
food. There's 2 pipes.
What's the pipe?
The trachea, the airway pipe,
Right.
is the one in the front, and then the one behind it is the esophagus. And you want it to go down the esophagus to the stomach versus the lungs.
Oh, so if I'm drinking water and then
it
I start choking, that's because it went into my trachea.
Yes,
not
yes.
the what was it?
Esophagus.
Not the
But now I'm worried.
esophagus.
Like when I'm eating, how do I make sure it doesn't go down the wrong
Don't
tube?
talk
wrong
and
pipe.
laugh. There is a wrong pipe. Here, early in
that
development.
was like a
Don't
bubba
talk
mice.
and laugh while eating. I feel
You
like
know
I'm
how
always
people
talking.
like talk and laugh
Yeah,
about
yeah.
eating and then they choke and gag?
Of course.
It's because they
You
didn't
inhaled
protect.
it instead of swallowed it.
Correct. Yes.
Okay.
But if I'm
This is the
chewing,
Penn degree right here.
This is it.
if I'm chewing normally and then I swallow, I'm not talking. There's no reason it should go in the wrong pipe.
Right. Yeah. I mean, if you have like a normal swallowing mechanism.
Okay.
I see. Okay.
But like often that is not what happens. A kid is like crying or they're screaming or they're
wait, hang on.
gasping.
So I'm picturing like the game Operation.
Yeah.
Where you got to go in there.
Yeah.
And like
There wasn't
literally
2 holes in operation. I can't remember.
take like a wishbone out of the lung or
Right.
what or whatever.
Right.
Oh, so
It
what is
wasn't
that?
out of the esophagus.
And you
Because
do
that would go down to the
endoscopically?
stomach and then the
So
poop it out.
So you're not okay. So esophagus is not your.
That's GI.
That's GI.
That's not really my realm. But actually, that's not true. That's not true. Just so you know,
Yeah.
we split esophageal foreign bodies of an on-call system between us, pediatric surgery, and GI. So actually, I take a lot of stuff out of the esophagus.
Interesting.
Just that's not dangerous in the same way.
because you can't lose your.
But
Right.
what would you need to take out of the esophagus? Like, why can't I just go
like
to the stomach?
coins. Because it gets
Oh.
stuck. It gets stuck. It's too
'cause
big.
if
It's too big.
Like wide. It's
Yes.
got to be the.
But if
it goes
it's
the
food
wrong
and it's
way.
a big piece, it will break down most of the time.
Not always. Sometimes a hot dog gets stuck
So
if they
a
don't
coin-
chew it.
A coin in the esophagus the wrong way. It's sort of like a breech baby.
Yes. Yes. Like a breech baby
Yeah.
quarter.
Yeah.
And it literally
I love
is
it.
like,
I mean, I don't love it. It's
no,
terrible.
it's really true. And by
I'm
the
like
way,
scared to eat again.
no, but what you're like just scared
It's
to
a
be have
fast
children.
day.
Oh shit!
Wait,
Don't
we
even
weren't supposed
mention.
to mention
Don't
that.
even mention. Do
it.
not
Okay,
mention
I
it.
didn't say it
because it's very bad. I noticed it on an email about my daughter's sleepaway camp, and I was like, "Oh my god, I
You know,
feel
you can't drink water on
really
fast day either.
guilty."
You know what?
Whatever, it's better than what we're drinking. Okay.
Vegas. Okay. So,
By the way, you mentioned the button battery. You were alluding to like
Yeah.
the battery thing. That's like
The worst, right?
seriously dangerous.
Especially 2 magnets. Can
Yes.
they,
Well,
that's
now
something
you're
else.
off in another direction,
Okay.
but yes, that's also bad.
I like know about every
You have
scary
way too
thing.
much stuff
I
in
want
your
to hear
head.
about the skittle in the trachea.
Yeah.
What color
Yeah.
Skittle was it?
Yeah.
Talia wants to
God,
know.
of
I
all-
don't know. I wish I could remember.
And-
It
and
feels like it was purple.
And does it dye? Does the dye like blur your ability to see what's happening?
No, the only time you get into trouble with like the kind of what comes off of the object is actually not to keep talking about nuts, but
Oh.
peanuts, because the oil actually really makes your airway reactive, like swells bad.
Going back to nuts, people
Right.
don't give your babies nuts.
Don't give your babies
If
nuts.
there's anything you learned today.
No nuts.
No nuts.
The Bamba, yes, right?
No, that's different. That's
That's a cheese
mushy.
doodle
It's
nut. That's
mushy.
a nutty cheese
It's
doodle.
not about the nut
doodle.
allergy part.
Right.
It's about the
consistency.
correct.
Okay.
Right.
So my partner, she's like super wise. She's like the Southern Dr. Leanne Dessert. She says if they can't spell it, they can't eat it.
Oh my god, all these like cool ladies.
She's so smart. She's so cool.
Wait,
I
so
know.
hang on. Have you ever like? I know you're talking about laparoscopic.
Yeah.
and-
Have I ever had to go like straight through? A lot. Yes.
And when,
yes.
when do you know you have to do that versus the
When you can't get it out the other way.
Oh, so
and
you
like
try the first way.
yeah, and like the shit is hitting the fan.
Oh
like they're
my
gonna
God.
die.
So you literally just like
Open it up.
the neck, and then you just. Is that easier though? Is that? Easier?
I mean, not from the perspective that it's like an emergency and there's blood and you know
And there's more
it's-
healing.
Well, I mean, it's much more invasive.
Yeah.
But like
Right.
I actually have I know we're Jewish and everything, but like you have to do a little knock on wood just in case, because I've not ever had to do that. But
you've never done that?
No, I've done tracheostomies many times, but not for airway foreign bodies. I've done it for like other reasons.
What would be another reason?
Like, and this isn't really funny, but like ex-preemies that have been intubated for a prolonged period of time, and now you want to take the tube out, but they can't breathe. So you give them another way to breathe that's more stable.
So I've watched a lot of TV shows where someone's dying and then someone like sticks a pen in their is that like a real thing?
What is that?
That's
You've never seen that on
I've
TV
actually
show?
had to do that many times on adults.
With a
basically, no, with like a knife, because I usually have a knife.
Oh, just to get the
It's
air.
just to have an airway, but the pen cap thing is because it's like a tube and it's sharp. So you like make the hole, but you better make sure there's a hole on the other end. Like some of the pens don't have. You're just going to stick the pen in there. It's not going to make them breathe.
Wait, so if you use a knife, but you got to know exactly where you're doing
you got
it,
to,
right?
I had one.
I can't just do that.
No. I had one weekend on call like 6 months ago where I had to do 2 emergency versions of that. Like emergencies, like blood spattering, like really
Wait,
serious.
back to the Skittle.
Yeah,
So
yeah.
that actually happens.
It's like, get back to the safe zone.
So you did a tracheotomy to pull it out.
Not the Skittle. There was.
How'd you get the Skittle out?
The Skittle I got through the normal endoscopic way. We have all these grabby instruments.
Out,
Yeah.
Do you think the parents learned their lesson?
Oh my God. I mean, they are like, it's the scariest thing that ever happens to you. So they are like petrified. They're probably giving them like mashed potatoes till they're 20
like
after that.
Applesauce forever.
Yeah, exactly. They're like, they're like indentures and they still haven't been allowed to chew, you know? They get really scared.
I can't even
For
imagine.
good reason.
Yeah,
No.
I can't even imagine.
Yeah.
What's the closest call you ever had?
Actually, the closest call I would say was a foreign body. And actually, this one, I wrote a book, or I have a second book coming out, and I wrote
what's it
this.
about?
It's basically kind of these things,
Yeah.
you know, like I chose 16. It's a random
That's
number.
why I bring it up, because I did read many of the case studies in that manuscript you sent me.
Yeah.
And so I would love if you would talk about that really
So
close
one
call
of the,
you had.
yeah, thank you. So, I mean, so they're basically like those stories, like, not, hey, I woke up one day and I went and I put ear tubes in a child, as much as I love doing that. And I do that all the time, but they're like the death defying ones, the ones that change your life.
Or
and
she's
like
flown in by helicopter because
right. Cause they're like, so one of them, which is, was like the closest call I would say of my career was, a from Hasidic child that you were asking, like, how do they access these foreign bodies? This kid, it was really weird. Like,
well, when you're one of 11 kids, it's hard to
I know,
keep
let's
track.
not judge because I will literally be
Sorry.
fired.
Yeah, it's a comedy
but-
show, people.
Yeah, exactly. But this particular situation,
Yeah.
apparently one of the older siblings was going to have a birthday. Mom had bought balloons, not inflated balloons. Somehow this baby, I don't know how, like not a 4-month-old baby, like a baby that can like pull things, had the bag of balloons uninflated, had fallen on the ground. And somehow this baby opened the bag and like swiped one of the uninflated balloons. But it was crumpled up, like the size of the airway, and then like kind of inhaled it and blocked the airway.
The balloon went down the baby's.
Yeah. Instead of like swallowing it where it might have been stuck, but like not dangerous.
Went in the trachea.
Yes.
Oh
And
my
so
God.
the
And it
baby-
kept puffing up and out.
It was just that it was the full, like there was just like a little column of air that the baby was breathing around. And otherwise there was this total obstruction.
But it wasn't
And
like a little balloon. Like
it
inflated.
was actually like think of
Like, it
like
could
a
have been a piece
wad
of
of
plastic, it could
rubber.
have been anything.
Exactly. It could have been anything, but it happened to be
balloon.
like an entire balloon crumpled. I didn't know 100% what it was. I just basically got called in
because you
that
don't
a baby
speak
was
Yiddish.
Exactly. I do speak a little bit. Titnishvai means it will not hurt.
Okay.
That's all I know.
Nice.
That's an important one for a doctor to know.
Stekazozon sing is stick out your tongue.
Okay.
That's
oh,
Yiddish?
Oh, wow. Oh, good for
I mean,
you.
I'm not
Sounds like
sure I'm
Mandarin.
saying all the words properly.
Oh, that's good that you know even a little bit. So, yeah. So then what?
So basically, I get like, this was full on emergency. And like I said, it's always like really bad timing.
Oh, where were you?
I was like doing carpool with like all these kids in the car after basketball practice. And when I got called, I'm like, do I have time to drop off like the sweaty kids? And they're like, no, there's no time. So I brought all these sweaty, like, preteens to the hospital with me and like dumped them in I just ran in, like that was like a run in, like a full on running.
Wow.
And anyway, it was like they brought in this baby, they flighted in, like meaning they helicoptered in this baby from like, you know, a Hasidic place that I will not specifically identify.
Why your hospital? That's the nearest one, or
Yeah, a lot of the communities we are the nearest. Like I was saying,
Westchester,
right? And I was saying trauma center. Like one of the things about trauma centers, they have a helipad.
Yeah.
So that's just like an element that you can like get in an emergency.
Right, that makes sense.
Wow.
Right. So the baby was breathing enough to be alive, obviously, but like very, very on the brink.
but those carpool moms were pissed.
Yeah. And I'm like the most delinquent carpool mom. I'm always
You're
like
out of the carpool, Tali.
I'm just like, I shouldn't be in the carpool. I never want to be in the carpool. I try to get anyone else to do the carpool. I will pay for the carpool. But this was like, it was my day. There was no getting out of it.
Do they do anything for the baby in the helicopter?
Like they were bagging the baby, like, you know, like with the mask and trying to push air, but like you can't,
like
you don't want to
temporary.
lodge it. Yeah. And you don't want to like push it further and then go to like full blockage.
Yeah.
Right.
Because that's worse.
No,
Yeah.
of course. They just have to keep the baby alive
did
until
the
you get there.
Parents know what happened, or
So apparently, again, when a baby comes in like full on emergency or any patient, they give them this like fictitious name. It's like Trauma Charlie.
Oh,
You know,
okay.
so like it's
Why?
just because I don't know, it's this de-identification thing. And then I didn't know the baby's name. I didn't know the parents. I didn't know where the parents were. Like this was just baby brought in, like floppy blue baby brought in, like
baby's face was blue.
like blue.
Oh, wow.
oh my
Pretty
God.
not
It's like
pink.
Toima Yitzi.
Yeah.
Okay.
Like not good, not
Wow.
good.
Yeah.
And that was like it's all on you. No one else can help you.
Oh my
it's
God.
now or never, like that type of
Let's
thing.
go.
Like full.
This is your adrenaline junkie
That's
persona
like-
kicking in with
Yeah.
all your expertise.
Yeah.
Wow, that's just amazing.
And it's like the calm. You have to be calm.
yeah.
Like
But
full
this
adrenaline,
is you.
but calm.
I mean, this is you.
That's like your moment. I mean, that's what
Yeah.
you train for. Like that's what you can do that no one else can do.
yeah.
Like,
Your
there's just-
superpower.
Right. Because like no one else can do it. Like people think, oh, why can't like the anesthesiologist do it? Well, they can't get stuff out of there. They can like mask, but they can't like get the thing out.
Of course not.
So then what?
So then like it was freaking crazy. Like there were so many people in the room. There was like all different people in the room, like someone from the ICU, someone from the ER. I don't even know, someone pediatric surgery, all these people, but they can't really fix the problem. And like, I have to say thank God, because it's just like reflexive, you know, because you don't know what's helping you. But if God's on your side, it's something, right?
Sure.
So anyway, and I got this thing out. I got it out.
the
I got
balloon.
it out. Yeah.
How?
And, I have this, it's like
Is this a tracheotomy? Like you went.
I didn't have to go this way. It's
really?
an optical forceps, which means it's like a grasping, like it has, just imagine like any tweezer-ish type thing.
down the throat.
Down the
Like
throat.
the claw machine.
Yeah, exactly. The claw machine, but like with a little camera at the end.
So wait, hang on. When you go down the throat, you see two
Vocal cords?
pipes.
No. Yes.
You see a
right.
trachea and a esophagus.
Right. But the trachea is like a hole.
You can see it?
Yeah, the trachea is like a hole, but the esophagus actually is like collapsed. So it's just like, it's not like two big holes. It's like one hole for breathing and then this collapsy thing that enters into the esophagus. It just doesn't look the same.
Oh, so
It's very
okay.
obvious which hole to go
No,
through.
I'm not saying you get
looks-
confused. I would get confused.
Right.
But
And I don't mean to be like sexual, but the airway looks like a vagina because it's got like two labia that are the vocal cords and like, you know where you're going.
Oh, wow.
It's not like you could poke the wrong hole.
That's
no.
okay. That's
I mean, you could, but you'd be really, really moronic.
That's very interesting. Wow.
Yeah.
So you're in between the labias now.
Yes, the
and
white
you're-
labia.
Okay. And you're seeing
And then like I saw this like
you
something.
can see it with a camera.
like kind of
Are
like I
you
saw
the
like
one
the
that
outline.
puts the camera
Yes.
in. Okay.
It's all like you with like your two hands.
Oh.
Is
It's
there
like
any like AI involved in this?
I mean these are like the future kind of directions, but so far it's just you.
No. So
Yeah.
okay, so you're
Yeah.
down there with the camera. So
Yes.
you got your two hands. One has the
Yes.
camera and one
One's
has
like
the thumb.
holding the instrument like for your view,
And one is the
and one is
tweezers.
your hand. Yeah,
You need
with the
steady
tweezers.
hands.
With the
Oh, not like
tweezers.
your
Yeah,
actual hand.
No,
You're
no,
not
no. I'm not like Gumby.
Yeah.
You know, my hand only goes so far.
So-
but yes, with the
so-
tweezers.
So you got it is tweezers.
But they're called like alligator forceps, but they're just like
But you got to be
claws.
so careful not to puncture.
What if it falls?
Right?
When you pull it, can it fall out or?
yeah. That's what I always tell. I
Oh.
always tell my residents like once you grab it. You like, you grab it for dear freaking life. And if you drop it, which
Yeah.
you can, don't panic.
You could go back.
You got to go back and get it.
Right.
Because sometimes you put it in like a worse spot, like
Yeah.
you're saying. You know, you move it, but you move it to like the worst place.
But how is the baby getting air in the meantime?
It was like a miracle, like around the edges of this thing. Like you have to have some movement of air, right? If it was a total blockage, they wouldn't make it.
But I thought I read in your book that I don't know if it's the anesthesiologist or an assistant or somebody like expands the air pipe for a while.
Yeah, exactly. Like they're blowing air, right? Like pumping air, but the anesthesiologist while I got there, but it's just moving in this like around the object, but not enough sustainable, you know, but enough to keep it for me to get there.
Right.
So she knew, she's very smart.
It's all women. You have an anesthesiologist as a woman.
In that case, it was this woman who's really awesome. Her name is Tara Doherty. I actually just worked with her on Friday with this other baby, and she knows not to like push it further. So she could intubate. Could put a tube down the area, but all she'd do would shove the object further. So that's why she's stuck with what she could do. And she has to wait for me to get there.
Okay.
So anyway, so I get this thing out and it's like a miracle, right? But then
I'm sweating.
right. But
Well, it is hot in here.
yeah, it is really hot in here.
I know. I'm just
but I'm
ratcheting
saying
up the
like
drama.
then you're like, okay, now where are the parents? Like, I want to tell them the kid's okay.
Oh, so as soon as you
haven't even met
solve
them
the
yet.
problem.
No, I never met them. I don't know who they
As soon
are.
as you know the baby's okay, your first thought is, let's tell the parents.
No, like once they're really stable. Like I'm not running out until I know like it's 100% safe. Because in this particular case, once the object was out, I had to put a tube. Like the baby still needed to like recover.
Trauma.
Yeah, they need to recover their lungs. But the thing is, it was like now I can leave the room because it's stable.
Ooh, okay.
So then I'm like, I gotta find, and this is why this is in my book. So I'm like, okay, now I gotta find these parents. And like, no one knew who they were. Nobody knew the kid's name. We didn't even know the kid's name.
Oh, wow.
And where the parents, you can't call parents if you don't have a phone number and a name. And
the parents weren't in the waiting room?
No, apparently they came in by ambulance while the helicopter brought the baby.
Oh, wow.
So I go to the ER because that was where they came in through to try to figure out if anybody knew what the parents looked like or where they were, how I could find them. And so this thing is just very funny because I know everyone said, we don't know. And one nurse says, it's some woman, a short woman with a wig and a very long skirt.
Right.
So I don't understand why, but instead of thinking it might be like a Hasidish woman, which would make a lot of sense, I just thought it was like one of those travelers, like the gypsy ladies. I'm picturing from like, you know, those shows, like the gypsies that like they travel and they live in clans. And that it was like, I was picturing this long flowy skirt and this transient, like flowing
like no
woman.
health insurance.
Yeah, just
she's
like,
gonna read your cards and read
like
your
I'm
palms.
never getting paid for this.
She's just like wandering around the hospital looking for her lost child. And that is who I was looking for in the hallways, like the little gypsy with the long flowing hair.
Right.
Not the Hasidish lady.
Meanwhile, it's Chani from...
It's Chani, like, Rosenswag.
Okay.
And she's...
Rosenswag.
You know, whatever. I don't know. Yeah. My point is, so I spent like a half an hour just wandering the hallways looking for the gypsy. I'm like, has anyone seen a little short gypsy, you know, with long hair?
So anti-Semitic.
I don't know what to say. It was so weird that my brain, all my brain power had been used up and all that was left was this like phantasmagorical,
exactly.
You know, image.
You're just, wow, you're toast at that point.
Yeah,
wow.
I was toast. But anyway, I gave up. Yeah. Because I was like, I'm not finding this, you know, fictitious woman.
Right.
So I gave up and I was like, let me go check on the baby now. And I'm going to go like up to the ICU. And I walk in the door of like the room and there's this woman like davening. Oh. And I'm like, oh my God. That's who the mom was with the sheitel and the long skirt. That makes so much more sense.
Well, then how did she greet you?
I mean, she was like, wouldn't stop davening. I'm like,
but did she know the baby was fine at that point?
I saved your baby.
It was
me.
It was me. Hashem is with us, but I did the work.
Please stop saying Tehillim.
And say, Tali, hi.
You are amazing.
Wow.
Yeah. So anyway, I found her and like it was all good.
That's great. Wow, what a story.
But it was like
really
that was like on the brink.
So is being a doctor your adrenaline rush, or you do other crazy things?
No, that's the point.
You're
of like
skydiving on the weekends.
That's like my exact example of what I'm embarrassingly petrified to do.
Oh, me too.
I'm like, have you ever skydived?
No.
Would you ever?
Would you?
I mean, I would.
You're
guess.
not afraid.
I would never.
I would skydive, but I wouldn't bungee jump.
Why?
I don't
Just
wanna
in
hurt
case
my
you don't
stomach.
come back up.
Yeah, I wouldn't parasail at this point.
You would or wouldn't?
would not.
Just because
Parasail's
of
not that
nausea?
scary.
Well, I feel like I've seen videos where the sail goes over your head.
Anything you could die from.
I know.
Pretty much ruling out.
Skydiving, I guess there's that fear that the parachute won't open.
Yes,
Yeah.
that is a big fear.
Yeah,
and
and
you
what
can also
about-
break your
But
legs.
there's
when
a guy holding you with a backup parachute.
No,
so
but
I feel
he
like
could
it's
die
fine.
too.
What about the falling part? Do you like
Yeah.
the free
All right,
fall?
let's be real. I'm not going to do it. However, if I had to do
You
one of those
could.
three
You
things,
could.
that would be, I would say,
You
I'll
would pick
do that.
skydiving over parasailing?
And bungee jumping.
I feel like parasailing is the least scary out of those three.
I've seen too many videos.
Right,
What
like where
happens
there's
in
a
the videos?
bridge and they forget about the bridge
Yes.
every time. That bridge has
and then
been
they just
yeah.
crash into it.
yeah, like the
Yeah,
boat
yeah,
is
yeah.
going and they forget there's a low
Oh my
hanging
gosh.
bridge. It's like the horrible story and it happens all the time.
But I go on a lot of I love roller coasters.
Oh, so you do like the dropping feeling.
I like.
Okay.
I'm an adrenaline junkie as far as like rides. Like
Okay.
I'm like a child. I never grew out of it.
Yeah, I used to like
Yeah.
it, but then it's like, I don't know, I got to a certain age. I'm like, my back feels
Well,
weird
no, I
after
can't
this.
go on that rickety shit.
Yeah,
Like,
not
like
wooden
at
roller
Hershey
coaster.
Park.
You'd like a back
you know.
brace, but you could do you don't mind the drop.
No, sometimes like you know like those like
Where it's like cranking on the way up.
yeah, like those really ghetto amusement parks.
Yeah.
Like I can't do that. I'll do the Disney. I'll do the what do you call it? Like that crazy elevator one at Hollywood Studios.
Tower
The
of
drop,
Tower
like
of
the drop,
Terror, I
that
like.
huge drop.
Yeah.
But what about Six Flags? I feel like Disney roller coasters are not really that scary.
Oh, really? Six Flags? I haven't been in a long
Yeah,
time.
that's a lot.
Yeah,
worse.
I don't know. I feel like once you hit like literally 35, forget 40s, but like
Your equilibrium
you
is
start
off.
feeling your vertebra,
Yeah.
like
You're like, I have a spine.
like yeah, like I have a spine and it's moving and it might be shifting and
Yeah.
I probably and you look at the age of everyone else in line and you're like, maybe I shouldn't be in this line.
Like 2 decades. If you're like 2 decades or more, it's probably
Yeah.
not a good idea.
yeah. So and remember, I used to go on the Gravitron.
Wow.
Oh, that's the one that goes
Is that
really
where it
fast.
drops the bottom out or no?
No, that's when you're like in a
like-
centrifuge.
Yeah, right.
Yeah,
right,
you
right.
can
yes,
like
yes.
stick to the ceiling. Oh, I used
That's
to love
great
that.
adventure.
Oh, they have
They have that at
there
Great
too?
They have
Adventure
that at Great
and
Adventure.
carnivals.
I'd be too
Yeah.
afraid to attempt that now.
See, that
I
I'm not
don't know
scared
about
because I
that.
feel like even if it drops, you're not really going to get so hurt. Like a roller coaster, if you fall
No,
from
but
the
anything
top.
It's the
that's
vertigo and the nausea.
Yeah.
It's not
You know
really
what? I'll go on
Right,
an
that's true.
insane roller coaster with drops before I'll go on like the teacup ride because it spins.
No, I agree.
anything that spins, like our heads at this point, like you get vertigo so
yeah.
easily.
It doesn't it doesn't know how to correct.
exact. Oh,
Yeah.
is that what
Yeah.
it
you
is?
can't even
Yeah.
do-si-do, you know?
Yeah. Like I've started getting nauseous when I'm turning the car, like driving.
Stop.
Oh,
yeah,
wow.
it's really
like
upsetting.
a 3-pointer.
yeah. And I'm like, oh my God, can someone pick me up
No
now?
U-turns.
Oh wow.
Yeah.
So no, you.
I only go
for you.
straight.
Oh, wow. So, okay. I just had a couple other things. Let's see. While we're all here, a couple things in the news this week. We always talk about our anxiety of the week. And I saw this crazy story online about a NutriBullet. Do you guys have NutriBullets?
Oh, yes.
Yeah. Like a blender.
Yeah,
it's
yeah.
I used to make
Make a
smoothies
smoothie,
all the
yeah.
time. They
So
were
I
really
actually-
trendy like 2 years
Yeah,
ago.
I bought
think.
one this week on
Yeah.
Amazon Prime, and I
Oh,
was,
did you?
Yeah, and what happened was it came, and the box looked like it was from like 1999. I was
And
like,
someone had like regifted it.
it
I
was.
don't trust.
It had the other person's return label still on the package.
Oh, wow.
They sent me someone's used like NutriBullet online, and then I saw the article too because I think
Prime Week
I,
is
you said it to
crazy.
me, or I
Wait,
said-
wait. So what
So
happened? What
was
happened?
a NutriBullet exploded on somebody, severed an artery
Oh
in
my
the arm.
in the arm.
God.
The picture looked like a murder scene. There was blood
I
everywhere.
believe
Blood
it.
everywhere.
And they said it's happened like 150 times.
What?
Wait, it like came off like it was rotating and then it just like
Yeah,
Is
the
that what
pressure
happened?
made it like combust, and the pieces of
Oh
Pieces
my
went
God.
flying.
Yeah.
Oh my
Severed
God.
somebody's arm artery. And what kind of injury for life? I mean, this
they
is
said
a
they're
major.
gonna have numbness in their hand. or
Right, because
something.
even if they like could attach it or whatever, they had nerve damage.
there's nerve damage.
Oh,
Yeah.
okay.
Because
yeah.
the artery, like you could actually stop it. You could stop the bleeding.
Right.
But the nerve,
I feel like if
gosh.
you're gonna do it, you push the button and then like run out of the room.
run away.
Wow, I'm so glad.
Maybe we should just do it like remote detonation
Oh,
now.
yeah.
You know, like a remote detonator. You can't get hurt.
Oh,
Go
remote
to the
NutriBullet.
living room.
Yeah,
It might.
Drone. Use it like a
Yeah.
drone. I'm putting my liners back in because it's
Wait,
been
do you
an
have
hour.
to wear them? You have to. Oh, you're in the all day long phase.
Yeah.
Oh, I hate that
Yeah.
phase.
I
How
got-
much longer do you have?
I got what are these called?
Invisalign?
Invisaliners, panty liners. I'm just a mess. Like
See, the
there's so
thing is,
many
like, you
Don't
know-
change your panty liners in front of us.
The
Invisalign, I'm
problem
cool
with
with.
Invisalign for me was like how much I drink coffee.
Right, you have to
How
take
many
it
times
out.
you have to take off and then brush your teeth again.
Right.
I can't.
Did you really brush your teeth every time? I did it
No.
first week and then I'm like, it's too much.
I started using
Really?
like a
You'll get
straw
cavities if you
for
don't.
hot
They said
coffee
you could-
all the way to the back down my throat. Like
Oh my God. Hope it goes down the right tube.
Might as well pump it through your veins at that
I
point.
was considering, you know,
insane.
any way to get caffeine.
So what about these Labubu dolls?
Wait. Tell me about that.
But you
Okay.
have daughters, you don't know about
Yeah,
the
but our
Labubu
daughters
dolls.
have aged out of that
They're
crap.
teenagers though.
Yeah, they're not.
But like adults are into it.
Oh, come on.
No, they're like
Really?
there's celebrities who are getting them and they're putting them on their like Louis Vuitton bags.
Oh my
They're
They're
getting-
so
god.
ugly,
Oh my
by the way.
god.
I mean, the craze is at the level of Cabbage Patch.
I'd say
Cat-
Beanie Babies.
I had 8 Cabbage Patches.
Still?
Oh, wow. You're so...
in perfect condition.
Look at
no,
you.
meaning like
So
as a
privileged.
child, if I still had them, that would be so.
I know. I would be like,
so
you're worth a lot
creepy.
of money.
I
I'd
have mine.
never admit that.
I had 2, Michael and Ginger.
Yeah.
And but the thing is, they smelled like babies. And
I
they were young.
know.
These boo-boos, they look like elf creature.
They look like troll
Like,
dolls.
why? Just because Kim Kardashian bought one, they're like not
You know,
cute
the-
and sweet.
The
How much
person who
are they?
invented it is the youngest Chinese billionaire.
It's insane. They're basically plushies with elf eyes.
Oh,
But what's
I see.
why people like them is because you don't know what you're going to get. It's like a surprise.
That was the same with Cabbage Patch. I got a redhead and I named her Ginger.
No, but
It
their
was so
faces were
exciting.
all the same. Did they have different faces?
I know. How long have you had it? Because I still hear a lisp. I feel like I got over my lisp in like 2 weeks.
putting in my liners and I'm going to sound normal. And I'm like,
So are you doing that? Are you wearing them on stage?
I tried the other night.
You really can't see it
Yeah.
from far
No, you
away.
can't see it, but you can. I
Okay.
hear it a little.
You
bit.
hear that little
I hear
twang.
a little twang.
But if no one knows you, they might just think that's the way you speak.
Yeah.
Could be. I don't wear them on stage. I tried once and it was like not good. And then I just had to acknowledge it. And then it wasn't that funny.
You're like, you know, when like actors get to the denture phase and you could hear that like hollow, it's really bothers me. I don't know. Like I just was listening to some older actor and I could just hear his dentures.
Oh my God.
Yeah.
I never noticed that.
Yeah, there's
oh,
like a
wow.
sound,
Ugh.
like the way it reverberates.
Oh, weird.
yeah.
So can you hear her Invisalign?
No, I don't. Actually, it sounds okay to me.
It's okay. Yeah. These are.
No,
It's
it's
just-
just the
it's
S
just the-
sound. You're like, it okay.
It's just the S.
It's also the facial things you're doing. Like
yeah, you're moving your lips a lot.
that's the bigger problem.
Because like you get a little like dehydrated. I need to like constantly
But how long
water
have you had
them.
it for?
I'm only on my 5th week.
Oh, so in a
It's a long
month you won't
haul.
even realize they're there.
Yeah.
You're
No,
still
I'm a
getting used
mess.
to
I
it.
have transition lenses. At night they turn into a vagina. I'm getting my ears re-pierced.
Why?
Because the guy said my holes are in the wrong place.
Wait, yours don't look
And I'm
so
like, that's
bad.
what my gynecologist said. So this is all just a lot
It's a
happening.
lot easier
You
to
don't
fix,
think it
though.
looks that bad?
I know
think
all
they-
about it.
Wait, but
I know all
really?
about
Why
it.
did you
yeah.
even go to ask them about it?
So
Like
I got
what?
my daughter's ears pierced, and then I asked him. I'm like, I feel
Like,
like
did
my-
it pull a
Like, are they
little?
not
Yeah.
symmetrical? They're not
Yeah.
symmetrical?
Yours aren't like hanging at the bottom.
No,
Like
they're
mine,
not like
mine
that.
is
Oh, yours
bad.
look how
No,
many-
no, mine is very
Cute.
bad here. I've
Oh,
had
yours
this-
are low too.
No, this one I've had revised 3 times. I
Really?
failed.
Stop
Yes,
it.
it's very upsetting, actually.
What's the
I have no earlobe left, and I'm very upset about there's one big earlobe and one small, but
Did
like,
the earlobes recede? I mean, what is going on?
no, like if you keep kind of taking out the scar part, there's like no real estate left. And that's why I stand mostly like this, so you can see like the good art side. And then
Yeah.
there's the scary old woman side. And I don't like
Wait,
this
Osha,
side.
you're not wearing earrings.
I don't wear earrings. My husband doesn't like the way they look.
What?
So I haven't worn them in like 20 years.
Wait,
Are you
hang on.
serious?
Hold on, back up the truck. Back up the truck. Your husband doesn't like the way earrings look on you?
No,
or
in general.
in general?
It's like this weird thing. I've never heard of anyone
Is that
complain
like
about
a
earrings.
Jewish thing?
Never.
No, it's nothing to
Never.
do with Jewish. He just thinks it like is
Trashy,
Or
like
you
a
look
belly
like you're
ring
one
or
of
something?
the like a slave from like Egypt. Remember how they used to like earrings were a sign of like ownership?
I don't know. You know how like you see someone with like a lot of tattoos and like some people might not like the way that looks
Well,
to him. That's what
yes.
earrings look like to him.
Just one pair.
Wow. He's so wholesome.
You're so lucky you don't have daughters. They have like 17 holes.
Right. No, and then you know what? I just took them out and then I never thought about it again. It just,
So you don't miss wearing
I don't
earrings.
miss wearing them.
You can always
Really?
wear-
They're so accessorizing.
Yeah, I love earrings. But did your holes close
No,
up?
they didn't because for his sister's wedding, I was like, you know what? I should wear earrings. So I like pushed it in and it went.
After 20 years,
yeah.
you got through the hole?
Yeah.
That is amazing.
wow.
And
main hole
shocking.
has
That
some
is,
memory there.
Yeah,
Yeah.
look at your...
So-
Wait, are you allowed to wear makeup?
I'm allowed to do whatever I want.
Just checking. It was a trick question.
Look at your holes. That's a big deal. We're all over the place.
Well, now my holes are intact,
part of the supply chain? Is it a fixable part?
Right. Oh,
Can't they just work harder?
but I mean, what do you think about that? Do you believe the women as grown-ups, actually all these people have
Undiagnosed?
I think it's because they see their kids have it and they're like, wait, it's probably genetic. And I went through all these issues. And if I were their age at this point, I would have gotten diagnosed. And then they go and get diagnosed. So
that's a good point.
Yeah.
There's a lot of truth to that.
There was kids with ADD when we were kids. I'm sorry.
No, of course there were. But the thing is,
Diagnosed.
right, but no, not to the same degree. Basically,
not to the same degree.
those kids were like failing. And that's the thing. No one's allowed to fail anymore.
Well, everybody gets untimed standardized
Right.
tests.
But that's what I'm saying is you're
It's
not
a
allowed.
racket in the private school. I mean, that is a racket today. There are kids in all APs, all honors that somehow manage to finagle untimed exams.
Right. Well, that's what I'm saying is that we're accommodating to everyone. There's good to it. There's bad to it.
Yeah.
But I think that's why, and also this scattered feeling that we all have, where there's a million balls in the air.
Yeah.
especially with
is that a
phones.
diagnosis or is that just reality?
Is that just real life?
Well, it's also carrying a phone around. Like, how many times are you trying to do something and then you get a text, you get a call, you
Right,
get
so you're
torn away, and then you
distracted.
forget what you were doing before. So it can feel like you're all over the place and that you need something to focus on.
More to be announced later.
Wow,
Awesome.
fabulous.
It's really,
And you can
really
follow-
good.
You can follow Tali on Instagram. What is
Yes,
it? At
Dr. Tali Lando.
At Dr. Tali Lando,
Yes.
Lando. And I'll be at Don't Tell Comedy in New Jersey this weekend. You can go to my website.
Amazing.
And we'll see you next week in the tea room. Subscribe and follow us on Apple, Spotify,
And YouTube.
YouTube, and anywhere you get your podcasts. Thank you, guys.
Thank
Bye,
you so
guys.
much for having me.
Bye. Thank you.
Bye.